Hello everyone. Today's video is about supporting sinus detoxification or sinus drainage as it's sometimes referred to in the context of like mold toxicity or MARCoNS or some other type of sinus colonization. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I posted a video many moons ago about a condition called MARCoNS. MARCoNS is an acronym for multiple antibiotic resistance coagulase negative staphylococcus. And basically it's this condition that's oftentimes talked about in the context of mold toxicity or mold illness, where there's this this antibiotic resistant strain of the staph bacteria that colonizes the sinuses. There's debate out there in the ether, in clinician circles, whether or not MARCoNS is actually an issue or not, and whether it's more of like a check engine light as opposed to an actual pathological entity in and of itself. And anyways, that's a debate for another video. And the reason there's a debate there is that some folks get all the way better, they're symptom free, and yet they still have MARCoNS, and they're treated for MARCoNS over and over again and cannot seem to get rid of it, and they still feel good. And then other people, have a lot of debilitating symptoms and test negative for MARCoNS, but then sinus treatment still helps them because maybe there's a mold colonization or yeast colonization or something like that going on. So anyways, that's a little peer behind the curtain in terms of the debate. But so the question was something to the effect of, do I have any recommendations or what do I use with my patients for drainage therapy as an adjunct to treatment for MARCoNS, and I'm kind of extending the conversation to sinus issues in general to make it a little more broadly applicable for folks. So to be perfectly frank, I don't do a ton of drainage support for my patients when they're dealing with MARCoNS or mold colonization or yeast colonization or other types of microbial colonization in the sinuses, and largely just because I follow the results is what it comes down to. I have used lots of drainage therapies in my practice over the years, and with some patients I still do use detox supports. I just have found over the years that the vast majority of patients don't seem to really need that support. And the way I gauge that is if a patient is working, say, with a sinus spray, so whether that's a biofilm disrupting spray with things like EDTA in there, or they're working with say a frankincense or other type of essential oil nasal spray or nebulizer treatment, I find that they tend to tolerate that quite well as long as we build up the dose appropriately. As long as we're not jumping into too strong of a dose all at once, then patient's body acclimatizes to it well and don't seem to really need that drainage support. Now, if I have a patient and we're building up the treatment intensity and they're starting to get sinus pressure, they're getting itchy ears, they're getting swelling or like irritation or pain in their face, their lymph nodes are swelling out to here, then those would all be indications that their emunctories, as they're called, their detoxification pathways seem to be getting clogged up, and so in that case some drainage support might be really helpful. What I tend to gravitate towards is targeted skin brushing. I posted a video on this a long time ago. I mean, well, long time ago is relative, I suppose, but I feel like a few years ago, if you search my YouTube channel for targeted brushing, targeted skin brushing, Brian Raid, the video should come up, and so it talks about this in depth. But so I won't get into it again here. You can cross-reference that if you're interested. But in my experience, in my opinion, it's the most effective way to skin brush to help move the lymphatics and kind of open things up a bit with those detox pathways. So I really like mechanical support for our detox pathways whenever we can use that, because it just seems to pack a lot more punch. It tends to work faster in my experience, and oftentimes better than more of like a biochemical support. I just had a patient earlier today. We were talking about using some herbs to help move the lymphatics, and they can be really helpful, don't get me wrong, but say herbs or homeopathics or homotoxicological compounds to help move the lymph in the absence of a physical support like targeted skin brushing, it's, in my experience, doesn't work nearly as well as the two combined. And then in a lot of cases I found that the patients were getting good results from the targeted skin brushing, didn't need to add in the drainage remedies, those homotoxicologicals, that kind of thing. So if we can get away with just the skin brushing and not add yet another supplement or herbal formula into the mix, then I'm all for that. And patients never complain when they have to take less stuff. It's the funniest thing. Don't have to spend more money. I don't have to take more pills. I don't have to swallow more gross tasting stuff. They don't complain. It's the funniest thing. Obviously, a little bit of Canadian sarcasm there. Of course, everybody likes taking fewer things and spending less money. if possible. So I really like targeted skin brushing, but in some cases, I certainly do recommend lymphatic drainage herbs, these lymphagogue herbs as they're called. That would include herbs like there's one called Gotu Kola, also known as Centella asiatica. There is nettle seed, there's burdock, there's Oregon grape, there's cleavers. So those are some of my top recommendations, and there's certainly others as well. I tend to recommend those in a tincture form for my patients because I find tinctures tend to work the best out of any different herbal formula. By and large, in my experience, there are other forms that can be used, and if it's working for someone, that's great. I like tinctures. They seem to pack the most punch in my experience. And then I have used a lot of drainage remedies over time, these like, biotherapeutic drainage, or also known as homotoxicological remedies. They're kind of like these compound, they're not quite homeopathics, they're kind of like at a junction point between like an herb or a medication that's working like very much on a kind of typical pharmacological level, and then a homeopathic, which is working more on like a resonance level or more of like a subtle, more like energetic type level, if you will. There's more nuance to it than that, to my understanding. But a homotoxicological is like a super, super, super dilute herb, but not diluted to the point where it's homeopathic. And so these homotoxicological remedies, or drainage remedies as they're called, they can be really helpful. I have patients who love them, they swear by them, and I have many colleagues across the world, mostly in Canada and the States, but other parts of the world too, and they like just swear by the drainage remedies. I've used different brands over the course of time. There's one from Italy called Guna that I used in the past. There's a company here from Canada called Viatrix that I've used. There's a very well-known one called Heal. I can't remember where they're based out of, but there's Des Bio. There's a bunch of different product lines out there, and they can be really helpful. And I've gone through phases in my practice career where I had lots of patients, going on different drainage remedies, and sometimes they really move the needle, and sometimes it didn't really move the needle all that much. So while I do have colleagues who put everybody on drainage remedies and swear up and down that like they're absolutely necessary and crucial for everyone, in my experience, I just found that some patients benefited from them and a lot of them didn't. So I tend to kind of hold it didn't like they were getting better. Just say they had Lyme disease, for example, or persistent borreliosis and co-infections. I'd have them on herbs and the drainage remedies, and like, oh, they're getting better. But then I had some patients who were like, well, for maybe financial reasons or various reasons, like, let's just put them on the herbs, and then they were getting better too. And so then I started not prescribing the drainage remedies as much, and it wasn't negatively impacting my results. So again, some patients, especially folks who are very sensitive, sometimes do really, really benefit from these therapies. I'm not throwing them under the bus in any way, shape, or form. Just if my patients can get better with taking less stuff, then man, that's great. But if it's helping patients, that's wonderful. And if patients are reacting to things easily, they're having detox issues, etc., then I certainly have drainage remedies on speed dial to help out. I do prescribe them from time to time. I just find they're not oftentimes all that necessary. So in terms of other drainage supports, I guess that would be the main thing. I mean, every once in a while I'll use some like ask patients to use like warm compresses, or they'll do sometimes we'll use some topical agents. There are some actually really nice topical homotoxicological formulas that have different there are like topical creams that can be used, so like rubbing those into lymph nodes can sometimes be really helpful. There's a topical procaine cream that we use from the compounding pharmacy that we get most of our IV and injection supplies from, and so that can be really helpful to move things because procaine has a vasodilatory property to it, so that can work quite well. Sometimes some hydrotherapy where it's like alternating warm and cold compresses, but yeah, for the most part, drainage for me, drainage support would be the targeted skin brushing, if it's even needed at all. Also, when we're spraying things like frankincense up our noses, it's a little bit caustic, it's a little spicy up there, and so I think that probably helps with a bit of drainage just in and of itself, and getting more blood flow and lymph flow happening in that respect too. If you're watching this video and you have your favorite drainage remedies, or have experience with targeted brushing, or anything related in this topic, and want to share your experience in the comment section. I know folks read the comment section, sometimes get some good conversations going in there, so please consider sharing. I read the comments. I read virtually all the comments. I miss one from time to time, I'm sure, but I read most of them, so please consider sharing. Also, if you don't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it, so thanks in advance for taking a second to do that. If you have any questions or comments on this topic or anything else, just post in the comment section below. I will do my best to reply as soon as possible.